Hi, it's me, Oscar, the Simple Surgeon. And today, with a new haircut and the use of microphone that will hopefully increase the quality of the sound, the audio that you're hearing, I'm going to talk about ingrown toenail, and this video is purposed to be listened to and watched by the medical personnel. In the last couple of videos, I told you about the management of ingrown toenail at home without often the need to seek medical help. And this will be the last scheduled video of this series. Last scheduled, but hopefully not the last, as I'm hoping to do another one answering your questions, should you have any. So if you have any questions or suggestions, or you want something explained, please feel free to write it down just under this video, and I would try to oblige. Now, down to the point, the medical stuff. So I am just a simple surgeon, and every surgeon has his own way of management. And I'm not telling you to follow my system. You can follow your own, but at least you will be aware that it exists. If you are not a medical person, you may still benefit from watching this video, as you will know what the others are doing to your toes. Sometimes the care at home is not enough and the patient comes to my rooms, and I follow a strict system to manage that patient. First of all, I'm advising them on the mechanical character of this condition. So I'm telling them, look, this is a mechanical disease, you need to treat it mechanically, and I'm going to tell you how and why. And then I'm giving them some statistics. So number one is the advice on the mechanics, and the second one is the statistics. 95 to 98% of my patients avoid surgery, avoid an operation on their toes with this condition. And that says a lot. And the second part of statistics that I give them is that 40 to 60%, depending on the research, 40 to 60% of people undergoing surgery will have a recurrence within 6 to 18 months after the procedure. And in my opinion, but I am just a simple surgeon, it is not because this operation is not good enough or the surgeon is not good enough. It is because they don't know how to manage their feet, how to manage their toenails, and the disease is bound to reoccur. Therefore, if they don't know it before the surgery and they cannot care properly for their feet before surgery, they're not going to succeed after, or the chances are only 50-50 or so. So I'm telling them, please try this before surgery and you may avoid it all together. Number 3, I tend to attend a lot of ingrown toenails in teenagers. And for some strange reason, they keep coming back to my place when runners. And runners are not good for your ingrown toenail. I said about it, I told you about it in one of the previous videos. So I tend to record every time they're in, record the type of shoes they're using. And I'm telling them, I am recording what shoes you're wearing. And if they come back in runners, I say, I'm sorry, but I have to put it in the medical records that you came back to me in runners, and that's not that I told you. And for some funny reasons, the written word, despite they don't actually see it, has the power to change the mind of a teenager. Sometimes, not always, but it is one of the good points. Number 4, whenever I see a granulation tissue that is not managed by the standard advice that I give, I'm doing a speed boost, speeding up the process by applying silver nitrate. Silver nitrate in the liquid form, 40 to 50% concentration, and this I give them 1 to 2 times per week. And I use a normal cotton bud for this purpose, and whenever I have, let me show you, whenever I have, though, I'm just applying it along the edge of the granulation tissue in the same manner that I'm advising them to push the nail bed, the side of the nail bed away. So I hope you're gonna see it properly. I'm gonna have it soaked in silver nitrate, and I'm putting it away to this side and downwards, and trying to apply as much of the silver nitrate under the nail bed as possible. I put a dressing there for 24 hours because the silver nitrate will be still acting in that time, and I need to warn everybody that whatever turns white, the granulation tissue turns white when you apply silver nitrate to it, by the next day it will be completely black, including the skin around and the nail itself, and that is perfectly okay. The silver nitrate will dry up the granulation tissue and help them move away the nail bed. It will also kill some of the bacteria, as the silver ions have the antibacterial action as well. If there is no progress, I go into surgery. So I apply silver nitrate maybe 1 to 3 times in the schedule of 1 to 2 times per week, and if that doesn't work, I often offer them surgery. I am not going to recommend any particular type of procedure because I don't believe it matters that much. The reason I'm saying that, there is a number, it's probably 14 to 24 different types and variations of the procedures for the ingrown toenail, and if in any kind of condition there's so many procedures that people are using, that means that there is no one best. Otherwise everybody would just use the one. So whatever you do, do what you know the best, and I'm doing what I know the best. But I don't think that the success rate is dependent on the type of the procedure. I think it's more about the patient conditioning, patient mind's conditioning, so they can focus and get rid of their disease as soon as possible. And this will be all for today. I hope this was useful, and if you have any questions or comments, please write them down, and if there are any, I will record another video answering your questions and replying to your comments. Thank you. Remember, this is what I think, this is my opinion, but I am just a simple surgeon.